Natural Samoa water, the taste of nature.
O te whatano whaatu Samoa, I le nei fo ia fiafi e ui lava lo whapena, o tau le ulo mai le tātou tau, I hea lo whangia lava tātou e owa. Le ini whaalawe lawe te tele o whapena o nā whainei so tātou atu no. Ai o le nei aso, ia o te fia whaalo atu, o le whaopopoma le nei o le tātou Polokalame o le Lavasiga. Ma o le nei la mai aso, ia o te fia whaalo atu, ua talia le tamatai fo mai, ia le tala me wala au ale nei fo Polokalame, a wā fo i se awanoa whai e ona whaatala noa I lungo le tātou Polokalame. E winga fo I lana clinic, ia pore po o tūranga fo I ia lana sāwalinga mai, o ia o se tamatai fo mai, ma o te fia whailo atu. Ia o lea ua tātou whaatasi nei ma le fionga ia nai, Siri ili Dr. Taralina Gae'e-Atefi Auva'a le tātou Polokalame le nei a fiafi ia vele nei a wanoa lawa fionga le fo mai ia na fura fionga fo ia nai. E mo le tau matu whaptaitali ino le matu wala au tu sai fo ia te loe pisi te le lo temi ia wha wanoa mai lawa ono le matu whaatala una mai.
Ia whaftai langi ia ave fo le nei tula e fia whawhilo e tuai I Malo o le tunu o lo whaifuin whatasi mai tātou Polokalame le nei tula. I ele ngata le nā ia vi e fwoi le ali o na ua o mai fwoi I le whai ungo le Vaega. So ia ngā luenga sa whea ngai mo le Vaega so atu. Ma e se le pisi. Ia e whawhitai fwoi ona o le hamana ia mai fwoi o se mātou tamawhainga I le nei fwoi tō ua pia nei I le mātou clinic. Ia o mawai fwoi se tātou I tūla tātou te whetaratara noa ai e ma whaso ai. Whawhitai lawa nangi Keresoma mo le apanoa.
Whawhitai Taralina ia po la fiong whiana nai o la tā whaangaina mo ia tūlou lava le whaafonga mai fo la fio anga o lo ia le suafa lo pali ai. Ia oi, ua lawi loe lo suafa sa e Taralina ia le o sila fia mo foi oi la tunu ia me se foi Pacificato. Ono le sa e tawa veina ia le pale o tau sala o tātou atunu. Ai o lava non me Taralina e pe whainga tā ona whaafaso o tai nisi. O e sa e tau sala o le tau sala Samoa ia le uwai atu na wamo mai lau na wharengon me o le stethoscope tūlanga e mawhai ana e saunoa lau journey. Your journey from being a Miss Samoa, former Miss Samoa, to where you are today.
Yeah, thank you so much, Langi, for allowing us to go back
down memory lane before you
going back down to memory lane and see how we were and where we were back then. So yes, so after Miss Samoa, and I think during Miss Samoa, I was very passionate about charity work. If you remember, we did a huge charity extravaganza where we raised money and we contributed to so it was always
and also the Vaega.
Yes. So I think that was my project being Miss Samoa. It was always about service. It was always about service. It was about giving to the community. And my bit of service was really around those who needed care, who needed extra care. So it was lots of Faaaloalogia and Mapufanga. So I decided, even after Miss Samoa, I should probably, it's probably a good idea to continue with that, with that vision to still do something along the area of caring. And so all of a sudden I found myself in completing my Bachelor of Science, and then after Bachelor of Science I was very lucky to have had the chance to study medicine, and then from then on it continued on until now, until where I am right now.
So where did you study medicine? Was it in Pacific or
Yes.
Australia? Or
Yes.
Can you just elaborate on that one for me?
Sure. So during the time with Samoa, I was just completing my Bachelor of Science in Biochemistry from Australia. But I'm a Samoan scholarship student. O ultimate titina ola mai nei Samoa na whanau I nei maola ma maula I nei Samoa ele ultimate titina nei whafo. So, but na ele le whamanu ia ngai I school sipi Australia. Ia na umale school sipi na whaumai manuia ia. Maolo fo ele siawa no whaftai Malo Samoa le na fo teimi. Na maolo le siawa no whai whafo mai Fiji.
Okay.
So I went to medical school in Fiji, and from there, the journey started going, and it's still going.
All right, so after Fiji and Australia, you came back, and then you serve at the National Hospital?
That's
How long did you serve there, or are you still serving there?
Yes, so when I returned from graduating with an MBBS, I did serve at the hospital. So I finished my internship there at the hospital, and then I decided to go back and maybe do a little bit more studying. So I went back and I studied. And
Where did you
studied in Australia.
Australia,
Yes,
okay.
I went there and I studied for quite some time there and worked there as well. And now after all that, I thought, okay, there comes a time when it's time to go back home. It's time to go back and probably give back to the country what I have hoped to build and create for myself. Maybe it's time to go back and give back. So that's where I am right now.
Okay, so you came back, you served at the National Hospital, and from there, this new clinic came up, the Positive Psychotherapy Clinic.
Yes.
Tell us about this clinic and what it offers.
Thank you, Lani. Perhaps I cannot go too much into detail with the clinic without acknowledging the experience in Australia, working specifically in mental health around suicide research. That was the area in which I was able to be very fortunate to have had expertise, guidance from the people that I worked with there. So working in suicide research for a long time in Australia, and returning home thinking what I've learned there and the frameworks that were learned during that time, I could bring it home to maybe apply it here, and
Yeah.
But I could, on arriving back and going back into practice, I could see, no, it cannot be applied. It's completely different context.
Oh, really?
There and here. So hence came the positive psychotherapy, because positive psychotherapy is a wonderful method in which the approach is not to have something rigid in which we will take community and force it into the constraints of that framework. It's actually, the framework is malleable to the needs and the wants of the community. Hence positive psychotherapy came into the picture.
I see. So I understand that, okay, so what you brought with you back didn't actually work with what you had in mind here, so this came up.
Yes.
The positive psychotherapy.
Yes.
Okay, so how does this, how are you doing this to the community?
Thank you. The very unique element of positive psychotherapy, perhaps I should still acknowledge that positive psychotherapy was founded by a psychiatrist. His name was Dr. Nosrat Bezeshkian, and he was Persian German. Anyway, this was back in 1970s. The unique element about this method is that it has got a very strong transcultural element. Something that is absent in a lot of frameworks in which we are educated in medical school and in other fields in medicine.
I have to stop you there. Okay, what you just said, my mind is going all over with what you just said. Can you just say that again in very simple English so that our people can understand what you're actually talking about?
Thank you, Lani. It's pretty simple, it's pretty straightforward. What happens with positive psychotherapy is you bring a method and then contextualize it. That's basically it. The contextualizing of the method is the transcultural element of the method. So, for example, in this part of the world where storytelling is something very unique to the Pacific Islanders. We don't have a writing language. We pass things from chest. So, instead of using a method that is alien to the Samoan people, alien to Samoan people, or something that's very new and foreign to the Samoan people, we could use storytelling as part of the psychotherapy, as part of therapy. So we wove in the cultural elements of wherever the method is used into the therapy. So let's say we go to India, or we go to, let's say, China. We have to, if I were to do psychotherapy there, I have to ensure that I have the Chinese cultural elements woven into it. I have to have the Indian cultural elements woven into it. If I work with the Native Americans, I have to use the same thing. So it's very specific, and that's why I feel humbly it's very relatable, and it's very relevant to us here in Samoa, especially being traditional people and very proud of our traditions. And our
so what are the Samoan cultural things that you're putting into this clinic?
Absolutely. So one important thing is there's a storytelling method, and also an important part of the therapy is we can go back to the Fonofale model, where the Fonofale model. Yes, you can go back to that. These are very, very important aspects of our culture. No matter how we want to, treat someone with mental, with mental unwellness or mental issues, you cannot go into trying to treat and manage these systems without thinking about Aina.
Of course.
You have to think about, you have to bring the Aina in. You have to bring in the culture. You have to bring in religion. Spirituality is very important. In other countries, there's no such thing as spirituality. You talk about spirituality, they kick you out and say, no, we don't want to talk about this stuff. In Samoa, it's very important. It's very central to us, being Samoan. So all those things, the environment, it's very important here. When we talk, when we do the sessions, you have to take into the environment at home. What's the environment like at home? So it's very, not only contextualized in the Samoan context, but also into the individual home situation of the people. Why is it umai aina manato dynamics? Umana asalatam titifal is tangata. I treat. To treatment it's a dynamics.
True.
So this is the very
must be very hard for you. I mean, looking at all these different dynamics. So how do you? I'm trying to figure out how you would actually sort of interact with all these different dynamics.
Yes, it's very interesting, Lami. If we go to indigenous wisdom from other indigenous peoples of the world, I'm talking more towards Asia, India, in Ayurvedic systems of healing and all that. They have this very beautiful sort of philosophy. They said, for the doctor to be able to manage a patient, first listen very carefully. Listen very carefully while the patient is talking, because within that talk or within that sharing, the patient is sharing with you. Within it is the medicine. Is the remedy.
Do you get emotional when you talk to them? Sharing the way?
Well, interestingly.
And how do you handle
that? so we are human. I mean, of course, you listen and we are all human. No one is, no one is too mechanical in such a way that they would not feel anything.
That's true.
So we are human, but in positive psychotherapy we are also trained as well because the philosophy is that we must, well, I suppose the indigenous philosophy is that how can you help others if you cannot stabilize yourself first? So we're not saying psychotherapists are super strong, no, we are human, but we've been trained, and also there are ways in which we have to we do debriefing, we discuss cases, that way we can share the load with other colleagues, especially with challenging cases. That way we try to stay sane.
How old is the clinic?
Also, the clinic is only a few months old. Yeah, so only.
And how many patients have you listened to and attended to so far?
Sure. So I don't keep a record yet, but one thing for sure is a typical consultation with a doctor would probably take about the usual one. If it's a really a short consultation, could go from 15 to 20 minutes. But with psychotherapy, you have to go most of the time an hour.
Of course.
Because you have to listen and you have to talk, and it's not just, okay, tell me your symptoms, here's your tablet for your diabetes, go and take this tablet, and no, you have to listen. So in that way, there's and it's also important for the patient to have trust, and for patients to trust the person they're talking to. You got to give them time. You can't rush them.
Right.
So that I see patients in my clinic, but I also see patients as part of my community service, free of charge at the hospital. So I do these services available for people.
Did I just say you agree that, okay, you're doing the clinic here, this is a private clinic for you, and you're also serving the National Hospital at the same time?
That's right.
So how do you manage your time?
Sure. So for this clinic here, we only operate on weekends.
On weekends?
And by appointment only.
Okay.
Yes, weekends only and by appointment only. But the hospital is also 1 day a week. So that 1 day a week, I make my way to the hospital, and if there are cases that are referred from the mental health ward, I'm able to see them. And it's a free service, where the clinic is private. Obviously, there's a charge, but over there, it's a free service, and in that way, people have accessibility. If you can't see us here, you can see us at the hospital, and it's accessible for people.
Do you see yourself working with, schools with disabilities students, like what you used to contribute a lot for the Loto Tamawhai and those way back during your days as a Miss Samoa, but now with all these new methods, the psychotherapy thing, do you see yourself working together with these schools again?
Interesting that you're saying that, Langi. At the moment, I'm very privileged to be able to be part of the new Autistic Society.
Okay.
Yes, for neurodivergent children, specifically looking at autistic and ADHD children. So there's already a society that's been formulated, and I'm very honored to have been invited to be part of that. And so I am already involved.
So you're already involved with
yes,
them, all right.
Yes. And of course it requires further training, because psychotherapy is for the general, but then when you want to go children with neurodivergent.
Where did you train for this specific method? Is it Australia, or did you go train elsewhere?
Oh, thank you, Lani. So Posse Psychotherapy's headquarters is in Germany, but I was trained by the center in London.
So you went in London?
I was trained in London. Well, it's still ongoing, by the way. So the first qualification is done, but now this is second going to my third year of the masters, which is more training.
Okay. And you do have a lot to juggle. You have your clinic and the National Hospital and other training. Have a lot on your plate.
But I think it's really because it's all about the same thing.
Same thing.
Yeah, it's not things that are very different from each other. Even the medical school and even teaching, it's about medicine.
Are you the first are you the first doctor in Samoa to be trained in all this knowledge? The first one.
Oh, thank you, Langi. Yes, so I am. I'm meant to be the first doctor trained in positive psychotherapy, and interestingly enough, I've also found out that I am the first to be trained in the Pacific and Oceania as well.
Wow.
So this clinic is the first, even in New Zealand and Australia, for this type of method. And positive psychotherapy is now practiced in 65 plus countries in the world. So it's not a small sort of method, it's not a
65 plus countries, and Samoa is the first in the Pacific.
Yes.
Are you saying that?
Yes. So we're first in the Pacific, and most of the countries are in Europe and in Asia Pacific, but we're the first in the Pacific and Oceania. So yeah.
All right. Well, it's this is too much for me, and I mean this is new. The psychotherapy thing is new. Okay, positive psychotherapy.
Yes.
Is there any Samoan name for positive psychotherapy?
Whawhitai lava nani mo ni whawhisile tāua tele, whamun mōre lava e whia matu se tausanga I uma o, I uma o mawhai o na whisoswani mai ki ne tuanga where it's very difficult to translate positive psychotherapy. We already have something for psychology, for example, psychology, but mind you, psychology is not the same as psychotherapy, is not the same as psychiatry, and so these are all different streams of
it's not the same as psycho. Someone translates just psycho.
That's right. So, for example, with autism, we really struggle so hard with the translation of autism because no matter how you translate it in Samoan, it's too broad. That definition would include hundreds of other diagnoses. It has to be very specific. So we ended up just going with autism.
So autism.
For autism. At this
so literally, it's a literal translation.
A literal translation. Is it upuna no fa Samoa? Upuna no mai isi upu isi ngana. So looking for linguists out there in Samoa who could help us. Perhaps some medics and some linguists, experts out there who can help with a translation of these very important terminology.
Also with medical.
Yes,
it's very technical and complicated.
That's right. And sometimes if we mispronounce words in English, the medical terminology, to me it doesn't matter because it's not our language. As a proud Samoan, I say, well, it's not my language, so if I pronounce it wrongly, it's fine. But yes, we need
so you need to have a Samoan translation.
You need to have a Samoan translation for this.
All right. Well, I think unless there is something else you want to talk about, something that I missed, I'm supposed to ask you something about your clinic.
Yeah, thank you, Lani. Again, I just want to thank you for coming all the way to my clinic to have this interview. I think just to maybe wrap up, I think mental health is something that we really need to focus on because it's an urgent sort of area that needs urgent attention. Our young people are the most at stake here. I think in a past speech I said that the most at risk people for suicide is 15 to 24 years old. These are our children, and going back to the family, the building block of every community is the family. Going back to family and really trying. No one's perfect, we are all trying. So maybe just starting first with our families and building those connections again with our children and our parents.
Malo whawhitai doctor ia le nasa moto whafunga mai ia e bea whule nei teimi ia lo whionga nai ia po la whionga fwoi le tumaitai fō mai. On behalf of the Lavasiga program, I really appreciate you taking time out of your busy schedule to speak to us, especially explaining and clarifying what positive psychotherapy is. This is all new thing to us, but your explanation and clarification, I'm sure our audience would love to hear what you say more. But I hope this is not the end of this, because I know you're still training, and I know there will be results from some of the work that you're working on, that perhaps we could have another chance to talk. Time allows.
Thank you so much, Lang. Yes, of course. I'm always open to catching up and talking about where we are right now, because it's a new field, and you know, when we practice, you see new patterns and observations. So you know, with that, you also change your practice as well. So
you seem to be enjoying it.
Yes, I am very much.
You are enjoying this,
Yes,
right?
I am very much, Langi. Thank you so much.
It's good to know. E Malo po ia te oe whakatai. Ia Samoa le nau tō whaafunga mai o le whai ole nau tātou Polokalame Lavasiga le vai aso. Ia ai o te taritono, ia toi maua le tātou awa no malawhionga ia nai, ia po siri li. Ia po te matai po mai a Dr. Taralina Gae'e-Atefi, a wāsisi tātou whaapoponga o le mata oku nei, au te iloa, o se tasila nei o tātou whaatantana o la whapena le tui tuli loina, o na ele ngātai fōu ia le nei fōi tau tua wau fōina mai. Ia ai mana i po le tātou tui tuli, ma mala atiri ai, i le whaonga ina fōi, o le ato mai. Ia me se fōi ia le tau tua lo whapena o na ufoina, e la fionga ia nai ia o le tātou Polokalame vai aso fōu, tui tuli lo mai tātou Lavasiga. Soifua.